Time. Ma'am, Ritu ma'am will join in 1 minute, ma'am.
Yes.
Yeah. Good evening, ma'am.
Yeah, good evening.
Good evening.
Hello, Rajshree. हाँ,
Ma'am, you're on mute.
I'm muted. नहीं यार, म्यूट नहीं हूँ मैं.
Nee, Rajshree, ma'am.
Yes, 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 yes. So,
ठीक ठीक. बारिश जोर शोर से है. हाँ,
अरे
मुंबई.
बहुत है, मुंबई तो पूरी बह गई, यू नो,
हाँ,
एवरीवेयर.
करेक्ट. चलो नम्रता कर दो स्टार्ट.
चलो.
Okay. So we are live now. Good evening, everyone. I'm Namrita Madesh from MediSage E-Learning Private Limited, a leading platform dedicated to empowering medical professionals through knowledge sharing, expert insights, and digital innovation. And today, I welcome you all to yet another insightful Med Talk on menopause and multisystem health, cardiovascular, bone, and metabolic implications. And today, we are honored to have two distinguished speakers with us, Dr. Ritu Santwani and Dr. Rajshree Katke. Dr. Ritu Santwani, a highly respected obstetrician and gynecologist, infertility specialist, and sexologist. Dr. Santwani holds qualifications including MBBS, MD, FECOG, FIAOG, and ART Singapore. She is the founder and CEO of 360 Degree Healthcare Studio NUHS Singapore and is recognized among the top 50 influential doctors on social media. Dr. Santwani also serves as the co-founder of MAAM and is a board member of SWWC, bringing a wealth of expertise in women's health. Joining her today with us is Dr. Rajshree Katke, a highly respected
Yes.
professor and unit chief and former HOD OBGYN at Grant Government Medical College and former superintendent of Kama and Albilis Hospitals, Mumbai. A renowned obstetrician, gynecologist, surgeon, and academician. She has mentored medical students for over 2 decades and authored over 100 national and international publications with 383 plus citations and over 2 lakh global reads. Dr. Katke has served on multiple national health committees and has been widely recognized, including in the UN Secretary General Ban Ki-moon,
बस
and
बस
recipients of
नहीं
prestigious
enough enough
awards
ठीक
such as Mumbai Achievers Award and Rajiv Gandhi Excellence Award. Experts, we welcome you to the session. And now I request Dr. Ritu to take the session forward. Over to you, ma'am.
Thank you, Namrata, and thank you, MediSage, for providing the platform for this the academic initiative. So, friends, today with me once again, my dear friend Professor Rajshree Katke is with us.
thank you
So,
Ritu.
yeah, most welcome. So, friends, as you all know, that today we are going to discuss something about the menopause-related issues. We know, as for being a female, we all always say it is not menopause, it is menopause. So what are the problems the females are getting at the menopause time? All are having a multiple issues. Some are having the cardiac problems, some are having a bone related problems, some are having a most commonly we are seeing the menopausal ladies these days with the metabolic syndrome. We are seeing the obesity is going on increase. So how to manage all these? So overall, what's the impact of the menopause on the overall health? So we are going to discuss related to that. Yes, some things we will discuss related about the HRT also. So if there are any relevant questions, you are welcome to put in the chat box. Me and Dr. Rajeshri will definitely try to solve the queries. So warm welcome to you, Professor Rajeshri, once again.
thank you dear friend Ritu.
So, as we all know, Rajshree is a very great surgeon, a very dear friend, very humble person, always down to earth, being in such a high position. She is always ready for the academic initiatives. So we all must support such kind of good academicians when they want to come in some big platforms. So um, a big, I can say, lot of best wishes for your all future endeavors. So now I am going directly to the topic.
Yes.
So, Rajeshri, as we have chosen the topic today related to menopause, and we are seeing these days that patients are coming with the diabetes also, that perimenopausal diabetes also we are seeing. So, what's your review on that? This question has just come in my mind. As we are seeing, in some patients, the diabetes chances are more after the post-menopause compared to the perimenopausal. So, what's your intake on this?
See, menopause itself is a cessation of menses. This is the definition, but basically, the hormones, they are the estrogen and the progesterone, they are coming down. So, hypoestrogenism is the most important thing which gives the dyslipidemia. Means there is the metabolic disorders in the form of low density lipoproteins. They go high and the high density HDL level comes down. So with this, the obesity is the one of the formation of that, and we know whenever there is a obesity is there, there is a insulin resistance in that. With aging also, we can see the islet cells of Langerhans, that beta cells, it has an effect on that. So most of the patients we are seeing about the diabetes because of the dyslipidemia, the metabolic effect of the hypoestrogenism, then inactivity. Physical inactivity is the one important thing, and third important thing is the dietary modifications. This can help and for the early diagnosis of the diabetes. I feel in a cases of not to go to the menopause, but the nature of the going to into menopause is the fluctuation at the perimenopausal age group, and there if we can see the hemoglobin A1C or the glycosylated hemoglobin, fasting postprandial sugar, and basically those patients who are genetically predisposed, previous history of that, the BMI, if they are having more than 25 or 27, then one should screen for the diabetes also, and we can pick up the diabetes and we can treat them efficiently.
Yeah, very true. Very nicely you have covered all this. So now coming to the another very important query related to this cardiovascular problems. We are seeing lot of patients coming with this post-menopausal hypertension. Earlier, the patients are saying, yes, no, their BP was throughout, the life was good. But now, as the menopause started, their BP is constantly going to shoot up. So, what's your take on this?
This is very important. See what it happens in that we are very much cardiovascular protected when the estrogen is in the body. That means in a phase of very a reproductive age group, young age group, and the perimenopausal age group. What it happens in that estrogen, it has the even estrone, estradiol, and the estrone. So basically, the estradiol component which we are having, they have a effect of the vasodilatation. That is one thing. Second thing is that it will remove the, it will reduce the constriction of that. It will reduce the oxidative stress in the body, and there is no fibrosis. So these are the beneficial effects. What we can say that the worldwide, if you look for the incidence of the cardiac disorders, they are very minimal or less before menopause because of the cardiac protection of the estrogen before going into the menopause. So in the menopause, what happens? Suddenly there is a hypoestrogenism, and in that the protective effect on the vessels, heart, and the metabolic, it has gone down, or it goes slowly. And in that postmenopausal or the menopausal, or in cases of perimenopausal also, the women, they are getting the hypertension. That is one thing. Second thing is that if you look wise, gender wise, male and female, before menopause, the male has a higher risk of the, I mean, as compared to the male, the woman has a very less risk of the cardiovascular strokes or cardiovascular disorders and all, because of this protection. But after menopause, it is increased as compared to the men. So it is very important to know that whenever there is a menopause, not only it has the other effects on the body, but these cardiovascular effects, they are more in this. That is one thing. People, they are coming with this sudden hypertension. That is the second thing. Then cerebrovascular accidents, third thing. Then IHDs are there. Then even the rheumatic disorders also, they have been linked or associated with this. So cardiac protection, or the cardio protectivity in a with the estrogen, it goes down with the menopause, and these things, they come up in that. So
Yeah, yeah,
so when
yeah.
the patients of the perimenopause, what we are saying is that you are confirming with the this testing of the blood in all that. First, you can get a ECG done also, and you can check the blood pressure is. Sometimes what it happens, these blood pressure or the hypertension is subclinical. And in that, sometimes if something triggers of happen in a life, and the patient will go into the cerebrovascular accidents or strokes. It's like that. That could be the one of the manifestation of the severe hypertension also.
So, yes, very nicely you have covered all the points. Friends, besides that, what happened? See, what happened before the menopause? Usually, we are seeing these days, a lot of the working ladies are coming to us and they are saying, "Ki ma'am, post menopause, we have started all these problems." So, the two things also, in my opinion, also contribute more. See, before menopause, if the working ladies, they are going to the work, some kind of the physical activities there. Now, post menopause, some think that it is a total retirement. It is a retirement only from the work, but you shouldn't stop your exercise, your activities, that should be continue. Besides that, we are seeing, as we Dr. Rajshree has very rightly pointed out about the estrogen. So we advise them, of course, for the some dietary changes that we are going to discuss. And besides that, what we tell, that please involve in some social groups. Don't sit alone at the home.
Yes.
It is this is actually very commonly we are seeing that menopausal ladies. कल ही मेरे पास एक पेशेंट थे, कपल आए कि मैम पोस्ट menopause she is having a lot of depression. So I am not a gynecologist. Yes, we are doing the counseling, but lot of patients we are seeing either earlier they are coming only with the depression. Now a lot of patients are coming in the menopause with the anxiety. Lot of anxiety they are having. They are worried for small things. Once they are working, they are not even having a time to think. So friends, while you're doing the counseling of the menopausal ladies, please tell them it's a time, it's their own time, it's me time, the menopause period, when their lot of responsibilities are over. And so they can indulge in their hobbies or some social activities, some social groups. That is also very important. So this only one point I want to add. Yes, Dr. Rajshree, you want to add something? Huh.
No, no. See, most of the patients, they, you are rightly mentioned that they are coming with the
Hmm.
depression. Irritability is one of the symptoms. And the
Correct.
problem is that when they are in a anxiety, depression, irritability, in that they are not
Huh.
realizing this is the stage of perimenopause going into the menopause and the postmenopause. At the same time, in the family is not very much of supportive of that. What they will think is that they are not understanding. So counseling is the major part of it. Even if such patients they do come to me, I always tell the family members also, she is going. See, menopause, this is the natural process of a life. So we have to accept it gracefully. At the same time, she should understand and she should take care of herself. But the changes are so sudden. So I always tell to the, the kids or the family members, they should understand her more, much more, because they will compare this mental disturbances with her previous life. And again, she feel that she goes again in depression because nobody is understanding her. That is what the thing is there. And you rightly mentioned that there has to be exercise, yoga, meditation. There is a role of hobbies, and they should go out. There was one very educated patient. She came also to me also. Let me share that. And literally, she cried for 10 minutes because there was so much of depression, and people are educated, learned, but basically they are not understanding the physiology of the menopause. So everyone has to
Correct.
help her till the time she can go on the track adaptation of the menopause, and going on that track. Till that time, she needs a support from the family, from the society, from the friends, and from herself also.
True. Very true. So now, as lot of doctors have a lot of confusion related to this HRT therapy. Before coming to that, let us discuss one another important issue related to thyroid. So
Thyroid.
yes, menopause and hypothyroidism. Also, we are seeing lot of patients these days.
Lot of patients,
And
because that is the endocrinological disturbances all over the things. It starts from not only these, the menopause causes changes at the neuronal uptake also, at the hypothalamus level. Emotional disturbances are there, and all the hypothalamic pituitary ovarian axis, in that also some of the changes are there. That's why we say that the neurotransmitters, which are serotonin, norepinephrine, and all these hormones, they will get disturbed during menopause. So this is the one thing where the whole endocrinology, you may get a thyroid, somebody will get even the pituitary, somebody will have some problems with this.
correct, correct. So before coming to HRT, what do you think is the role of the diet and lifestyle changes?
So this is the major
Ah,
contribution of all the basic of all these things. What you can say that the diet is very important. We say Anna Purna Brahma. I mean, diet itself is a medicine basically. So in that they should have more of the protein, calcium rich, protein, either a vegetarian or non-vegetarian. Fish is the very good source of omega-3. Then you will have pulses. Then even the millets is the one thing. All the pulses you can mix and you can make it of that also. Then nuts, that is also, it is very good for in the form of the protein. Then milk, then you can say that if they are non-vegetarian, fish, meat, and egg white. That is because in a menopause, the cholesterol and triglyceride also, it goes high up in this. So always we should take care to avoid the food which will increase the triglyceride and the cholesterol level in the body. And some of the good oils that can increase the HDL, that one should incorporate with the things. Avoid too much of the fried food. And then you can use the fruits, seasonal fruits, vegetables, and incorporate in these things. So whenever you are taking a plate, see that there has to be 25% of the carbohydrate, almost minimum 25 to 50% of the protein, and rest of the things less or no oil. No oil is not possible with the Indian tradition, but less oil, less fried. That is the mantra of getting a good diet. Then second is that is what you said is the lifestyle modification. This is very important with lifestyle modification. Walking minimum 150 minutes in a week is supposed to be, you can do it, or you can walk at least minimum 40 minutes in a day. That is also very good. If somebody is doing the stretching or the yoga exercise, that is also very good. Or gym, somebody gym or swimming. Swimming itself is a very good for the whole of the body exercise. Then some people, they do go for the Zumba and all. I said, if your knees are very good, then you can go for that. Nahi to otherwise, again, you will have bone has its menopause has its own impact actually on the bones. That is the very important thing, because there is most of the osteoclastic activity whenever the estrogen is down in that, and less of the osteoblastic, and the bone resorption will be more with that. So always, if the T score, if it goes to more than 2.5, then bone marrow density, then it becomes the bone mineral density, then it becomes a problematic. She is prone for the fractures and all those things. So this is the weight bearing exercise, this is to do that with the gym and all. See, most of the people, some of the people, they are very fond of the gym, some of them they are not fond of that. So what I feel is that you remain active, do walking, brisk walking, especially for 10 to 15 minutes. That also helps in that. Every person's the body constitution is very different. Their lifestyle is different. What suits to you, that one should go for that. That is what I will feel. And at the same time, we are looking for the physical health. At the same time, one should take care of our mental health, emotional health. That is also very important, because whatever maybe your the physics is very, very strong, and but the mind is weak, then it becomes very difficult. Because nowadays we say that these all emotional disturbances can create a lots of stress in life. So one should go for the meditation or keep silence for ourselves, focused in your life. Nothing is permanent. Everything it is going to get live here. We have a permanent, we have some limited span here on this planet. So enjoy the life. And the menopause is the one what you said, me. For me, it is a me no pause. So basically, there is no
Yeah.
pause for this is one of the life's phase. We enjoy the childhood, we enjoy the puberty, we enjoy the reproductive age group, and as per the aging, we should enjoy the menopause also, and that is what the new trend is coming up also in most of the cases.
Correct. So very rightly you have pointed out all the points. Only two, three things I want to add. As Dr. Rajesh is very nicely pointed out about the diet and the role. Only one thing I want to add that in the menopausal time, there is a lot of muscle wasting. So
Yes,
addition of the protein is must,
must.
1.2 to 1.5 gram per kg body weight. So means, in fact, I to motivate my patients that you can consider protein as a like a new estrogen supplement for your muscles.
Yes,
So you have to include some of the other protein in your diet. In a practical solution, if I will tell, a small bowl of dal or
dal,
our Indian diet
moong,
is very rich, dal, moong,
complete
or
moong.
chana, rajma, that all are very good. So before preaching to the patient, we have to include in our diet also, because we are the role models. Patient जब हमारे सामने आता है, so of course the patient will also see us. So yes, if we are having all the things, then only we can uh, teach the patient properly. Other very important thing, as Dr. Rajshree has very rightly pointed out about the kind of the exercise. So any kind of the exercise is good. So these days is a trend of the trendy watches, so minimum 10,000 steps per day is the golden rule what we are suggesting to the patients. Now this is the rainy season. Lot of patients saying, "Ma'am,
It
आपने तो बोल
doesn't
दिया."
happen 10,000.
हाँ
Golden rules are
हाँ
to take. They
हाँ
go around
हाँ
5,000 also is good. I mean,
हाँ.
they should be active
So
one.
Yes, yes. So, yes, we tell them to any kind of the activity they can do, dancing, Zumba, swimming, whatever,
Exactly.
or the inside activity, skipping they can do. So, these are the some modifications they can do. And third, as Dr. Rajshree has also pointed out, that at the time of the menopause, you have to be physically active, not like that not to become a couch potato, you have to be active. So, before including all these medicines like HRT and all that, so you have to do some changes in your lifestyle also. I
Very
think
right,
this
very right.
lifestyle changes plays a very, very important role. So, Dr. Rajeshri, if you want to add something about the HRT, you can add, please. Huh. Hmm.
See, the most important thing is that apart from the bone health, genitourinary symptoms are, this is the one very vital for the women in
Very
that
true.
there will be a
Huh.
dryness of the vagina, then difficult or painful intercourse, dyspareunia, libido is there, mood changes is there, and in that also we have to be considered in that. That is the one part where the women they don't tell us. So we have less of the time, so about the MHT, I would like to say that if suppose if you can start in a perimenopausal, at least age group, most of the people they are being started just before the menopause. That will give the more help of it. But basically, if suppose this is the combination of actually estrogen with the progesterone, either you can give a conjugated estrogen or the estradiol is the one of the form of that in the form of 0.625 milligram or 1 to 2 milligram in a estradiol validate in that. And if the uterus is there, because this causes most of the endometrial hyperplasia, so if the uterus is there, you can add with the progestogen in the form of the medroxyprogesterone acetate or dihydrogesterone or the natural micronized progesterone also. So you can give it either it with the continuous basis with the estrogen, or you can give with the sequential, last 14 days of that. So this is how one should go with the MHT if it is required one. The one of the most important part we have not touched, Ritu, is the vasomotor symptoms, which is very important in that, because most of the patients they are coming with the hot flushes, palpitations, and anxiety and all, because with the and that is very important to set the thermoregulatory body in that. So for some patients, you can this MHT, it will help in that. For the bones, even we can go with the tibolone or the bisphenol, or we can say that zoledronic acid and all. These are the things where you, with the combination of the orthopedics, if they are prone to have fractures and all, one can go ahead with all these things. So in
Yeah,
short,
Namrata, you can take
about
some
them.
questions that they have received.
Then in a non-pharmacological agents, we can see black coach is there. Isoflavones are the one. These are the things. So one can work with that actually. So these are the some of the multiminerals and all which support and strengthen the things with that. So
Correct. Yeah, very nice. Yeah, yeah.
So,
Yeah,
ma'am, the
Namrata.
questions we have
Huh.
received, I'll just read it out. In your practice, do you recommend routine lipid profiling and echocardiography post menopause?
yes, ideally one should go ahead with that. The lipid profile is one thing. First, you can see with the BMI also. Then lipid profile, sugar, glycosylated hemoglobin, ECG also. And one should make a routine part of it also in a perimenopausal and the menopausal women also. Because if suppose you can pick up, you can treat it in rightly in early phases. But if you don't pick up it, sometimes they can come with the complications of that.
Okay. Ma'am, the next question we received is how effective is HRT in reducing cardiovascular risk and in which patient groups benefit most?
See, if suppose cardiovascular patients, if they are not, if they are having some issues with the this hypertension and all, so we can give with this thing, HRT. But if the patient is too much of the obese also, then estrogen is one of the problem. Patient which has a liver disorders, which has a coagulopathies, or they are prone to have a DVTs and all. In that, one should avoid giving the MSTs and all in that. If suppose they have the uterus, then go with the progestogen also. If it doesn't have the uterus, then one can switch over with the estrogen of that. The progesterone you can give either oral form also, and the various forms like these progestogens, we are using metroxyprogesterone acetate, dydrogesterone is there, micronized progesterone nowadays, or even the LNG IUDs also. But for the cardiovascular, what I would like to say that, and with the liver disorders, one can use the patches or gel or the sprays in that, where they can pass the first pass, they bypass the first pass metabolism from the liver and all. So it has a effect to reduction into the cholesterol and increase into the HDL level, which is scientifically proven in that.
Ma'am, the next question we received is, how do you decide between estrogen only and combined estrogen progesterone therapy?
See, estrogen, you can give, estrogen has an impact with the hyperplasia, endometrial hyperplasia. If the uterus is there, one should go ahead with the combination of the progesterone with that. That is how one should go. And if there is no uterus is there, then you can go with the low dose of the estrogen or the estradiol in that. Either in the form of the conjugated estrogen, we can start, book says 1.25 milligram, you can start with the low with 0.625 milligram. I suppose the patient is having, lots of complications, liver or these things and all. If you feel that you should not go with the oral, go for the patches, estrogen patches are there. Some the gel sprays, it's not very popular, but people are using with the patches, estradiol patches. One
So very,
thing
yeah.
is that because we are in a tropical country, so how much is the absorption and sweating and all, how much it gives the effectivity is that is the one question of the this thing. And if you want to give the progestogens, people are using with the implants or the even the IUDs also.
Yeah, very rightly you have pointed out. Yes, as Dr. Rajshree has just told, yes, being a tropical country, so yes, in our country, the uses of the patch and gel is little less.
Little is
Though
less.
yeah. So,
But
but those who want to avoid the first pass metabolism, for them, yes, the this gel is a very good option, very easily available and economic also. So they can go for that. And as Namrata, you asked the question that which patients, as Dr. Rajeshri very rightly mentioned, with the intact uterus, yes, we want to give the estrogen and cyclical estrogen and progesterone. Besides that, these days, na Namrata, we are getting some patients coming in the menopausal age group, but they are saying, ma'am, no, we want the menses. Still, we will feel fresh once the bleeding has
yes,
come. So, yes, so in that,
very rightly mentioned in that.
uh,
So they
yeah,
even with
uh,
the continuous
uh,
treatment, they want a withdrawal of like things. They feel
yes,
that this is the some
uh,
of the
yeah,
like a femininity. They have preserved the femininity.
yeah, yeah.
Other-
So, yeah, so this means yeah, Baki rest, Dr. Rajshri has covered very nicely. Yeah.
Sometimes they says even the I would like to ask you, and what's your take on that is
Uh,
this oocyte preservation, and after using it in a menopause, that is the one thing people are working on it. So I think this could be a future of this. What you say?
yes. See, post-menopause though is not means I don't think, in my opinion, it is not much. If you want to go for the oocyte preservation or the embryo cryopreservation, yes, that should be as early as possible. Yes, though some patients are coming to us that in the menopause for the there for the embryo transfer. In that cases also we have to, because these days we are seeing the patients are coming of the menopause of 45 years also, 46 years also. In that patients, if we have done the earlier oocyte and embryo preservation, in that patients, yes, if we can make the good endometrial lining, that can be useful. But at the
They
time of the
there are
menopausal, yeah, at the
yeah,
time of
please.
the menopausal age group, doing a oocyte preservation is little less
No, no, no. The one
practically.
is
But now I'm coming to that. But
they
these days now, what a lot of studies has come for the ovarian tissue transposition also. Taking a ovarian tissue and putting here in the elbow. Huh? The studies have come. Taking out the ovarian cortex and again that we are reinserting. So augment the mitochondrial transport. So these are the some new techniques have come, but still are in the trial, means not the
Trial
still
as
lot
this.
of studies from the Cochrane study. So these
Mhm.
are the ovarian rejuvenation therapies, what we use the word. So there are a lot of things are coming, but every country has a different
Different.
protocol and different rules and regulations. So very rightly you have pointed out that I think
I have read a very nice study where they have even for the premature ovarian, premature menopause or the premature ovarian failure in that. What this is ki sometimes if you take it out, this some of these ovarian preservations and all that, and then we can the same ovarian tissues after preservation, if you can
yeah,
either
yeah.
transposition or either
The same thing I told
and
you, na, ki ovarian tissue
that's why I
transposition.
test the
Yeah,
I
yeah.
test
Ovarian tissue transposition is coming
that
into
is
the
coming up.
limelight only, but still lot of work has to be done. Not
Yes.
this
Even
is one
this one of
society. The ovarian tissue means not ovarian tissue. That is a gonadal
my
tissue
oocyte gonadal.
bioregeneration. Yeah. So for both, for the sperms and for the ovaries, for both the studies are coming.
They are
Hmm.
even coming good this good with the in cases of the young cases of early malignancies in that before going to the
Correct.
chemotherapy they are
Yes.
keeping and the preserving it and they
Yes.
can use
Yes.
it for the future fertility. This is a
Yeah. Yeah. Yeah.
fertility preservation even approaching in a I mean help into the menopause in cases of the premature ovarian failure.
Correct.
So this
Correct.
is
Correct.
the
Correct.
future of the things. Anything can happen nowadays. Technology are all advanced. Even they can come up with the artificial ovaries with the hormones also. We
Correct.
don't
Correct.
know.
Correct. Correct. Correct.
Can
Correct.
happen.
Yeah.
So these are the things I think we have covered all the points
Points. Yeah.
about the menopause and all. It is always wonderful to be with Ritu, Dr. Ritu, and she's the wonderful academician, knowledge sharing, and a very good infertility specialist in both at the national, international level, and really
Yes.
good to be here. I mean, this is the one thing I always appreciate that. Uh, Taking so much of the time from the even the her I have seen her practices are so very at a high level, but still she takes a time and do the things and all. So it's really hats up to you.
Likewise, my dear
It's
friend.
very
Likewise.
thank
Likewise.
you, but
Likewise.
it is always anything. Basically, you are the inspiration to the people who are, taking so much of the interest into the academic platform. And that is wonderful thing is that whatever we have,
That
we should tell to the people. That is what to the fraternity. This is the biggest work one should do or one can do in our life, being as a doctor, apart from treating the patients. I think wonderful, wonderful.
idea that all is possible because the friends like you who are also believe that the knowledge is
Yes,
always
I'm
increasing
always
and
with
sharing.
you
I
and
know
because
because
very
I
good.
know
So
you are the only
very
person
nice.
with whom I have done the webinars at the time of 11 p.m. also. Miss
But
Rajshree was
they
the
have
one.
benefited, na? Ritu,
Uh,
they have benefited because many people they tell me
uh,
also, they might be telling you also. Ki
uh,
it is very important for the even the young generation also to come up with all these ideas and all. And thank you, this MediSage also giving platform to us
yes.
for this knowledge sharing
Yes,
us.
special thanks to this my beautiful Namrata who is always ready to support. Huh? And
Ready to
Diksha too. Diksha is not here. Diksha तो मुझे मैसेज डालती रहती है उसको जवाब भी नहीं दे पाती हूँ कभी कभी. It feels so bad. So and thank you Rajeshri once again. And thanks to
thank you all the people also
and
who has
uh,
joined.
and thanks to yeah, all dear friends who have joined all across the geography. So with this we will wind off today. Over to you Namrata. Hmm.
Great.
Thank you, Dr. Rajshree Katke and Dr. Ritu Santwani, for this insightful session. And we deeply appreciate the time and expertise you've shared with MediSage community today. And to our viewers, thank you for joining us. We hope this Med Talk has enriched your understanding
Yes.
of patient education. Don't forget to explore more such expert-led session on MediSage app. So until next time, stay tuned, stay informed, and stay empowered. Good night,
And
everyone.
before, yeah, good night. Before we wind up, there is one important appeal to everyone. My friend Dr. Rajshree is standing for ICOG Governing
LCOG
Council
Governing Council.
election. So please try to support such academician who is always ready for doing such great work for the academics and always ready to support everyone. So my
From
all best
1st
wishes to you.
September to 10th
As she-
September. 1st
Yeah,
September
yeah,
to 10th September.
yeah.
Yes,
So
yes.
with that, we will wind up for today. Bye bye.
Thank
Good night.
you. Thank you.
Good
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 night.
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 Good night. God
Good
bless
night.
you.
Yeah.